But one of the things that I think is important about today's presentation is it's introducing the value of data in a way that is complements all of the data that we've been getting, certainly here in the United States, and I assume around the world, about the health implications of COVID-19. And indeed, there's a big debate happening here in the United States about the value of data and scientific evaluation, certainly about the health implications of the pandemic. But what we need, and what this research attempts to do quite successfully, is to get at the social, economic, political, human side implications of this health crisis, which are, as we'll see, equally important. It's interesting too, because we've developed a new vocabulary, and it's a universal vocabulary that everyone is using now. Now everyone is talking about social distancing. They're talking about contact tracing. They're talking about essential services in a way that we haven't before. And certainly the word lockdown, which is certainly part of the focus of this research because of the policy in India. But we also have another word that and in fact, it popped up this morning again, the new normal. And for example, this morning in the Jakarta Post, there was a headline that President Joko Widodo is now employing the Indonesian Army and the National Police to guard crowded places in preparation for the so-called new normal, especially in the new mass transit system. Things are different and will be different. And this word new normal will probably stop being used once the new normal becomes more institutionalized. But the point is, so much of life is changing, and certainly the human dimension is particularly important. Also, I think what's important to think about from your own perspective, wherever you are today, wherever your origin is that the pandemic has brought to light inequities that we've known about for a long time. We've studied them, we've researched them, but without the kind of urgency, I think, for immediate impact because of the pandemic creating this emergency. For example, in the United States, what we've discovered is almost across the board, except in very rural parts of America, the COVID-19 has had a disproportionate impact on people of color, especially African-American communities. And why is that? Well, partly it's because of their economic status and the fact that they, in many cases, are those essential workers who have to get out on the lines, whether they're nurses or working in transit or picking up the trash. But also it's because the health system itself has inequities built into it, and the health issues that have made this COVID-19 virus so lethal are particularly prevalent in minority communities. I think we can see that certainly in the case of India and some of the data that's presented in the study, and I think that's important to point out. Today's webinar will focus on the findings of the study undertaken by IMPRI with a whole host of volunteers, students, and others who volunteer, based on 6,000 telephone survey conducted over a 10-day period in May to assess the impact of the lockdown on the urban poor. And so what we're going to do, the format is that we'll have a presentation of the survey results by Professor Suryadip Chattopadhyay, a senior fellow at IMPRI, but also an associate professor at Vishva Bharati University, sorry about my pronunciation, and then a panel discussion led by my colleague, Dr. Abhinav, who is director, as I mentioned, of our Center for International Design and Planning, and who actually helped organize the research project. So he will take on the leadership of the panel discussion afterwards, and then there'll also be time left for question and answer that you can contribute to the discussion. So at this point, let me turn it over to Sumyadip for the presentation.
Thank you, Chris. Just I'm going to step in briefly to, first of all, thank you everyone for being here, and especially, and given that, you know, we are at this point of time, we have on the screen people from 3 different time zones. So we are US, UK, and India. So thank you really very much. And also, I want to talk about a couple of things. So one is that this was possible because of leadership by Dr. Arjun Kumar. Also, he's director of IMPRI, and I always used to think that, you know, I'm very pushy, but I think I have found my match. Uh, uh, he has been relentless and very effective. Other thing is, this is just a partnership we are starting because we understand at CIDP and IMPRI, we have had this discussion, this study, and we are now convinced that this is something we need to talk more often about. Especially COVID-19 has been brutal, especially for people who are poorest of the poor, the most vulnerable population. And this has already derailed urban life in urban spaces. And we know that the impact of the pandemic is still being realized. We don't know what has happened and how much is going to be the cost overall, and not just the economic cost, the human cost. So far, through our study, we have observed that how this crisis affects the city makers and the cities physically. This is what we are trying to understand. This is what we are trying to determine. For example, one of the op-ed written by Paul Krugman in New York Times, and he says that this is not a conventional recession because we are somehow all over the world treating this COVID-19 or pandemic as a conventional recession, but it is not. It's much more than that. It should be treated as disaster, and all the payments, like we are talking about giving stimulus all over the world because there is a um, um, lack of demand. We need more effective demand. Very Keynesian approach, what worked in 1929, we are just trying to go around with that again. But the problem is, this is not a conventional recession. This is something which should be treated as a disaster, and all the payments should be treated as a disaster payment rather than a conventional stimulus. So, and the payments or the aid should be generous enough, not calculating how much you need and you know, what kind of households you have, which we have done so far. Another approach that needs to be seriously taken into account is that of technologies in cities. This is not something new. I know that the scale, because right now, at some point of time during COVID-19 lockdown, almost 1.2 billion people were in lockdown, either partial or complete lockdown at one point of time. This is unprecedented, no doubts about it. Overall, since today morning, there were 5.7 million cases so far, with more than 350,000 deaths worldwide. This has affected about 212 countries plus territories in the world. So the scale is unprecedented, no doubts about it. In India alone, the cases have been 153,000 so far, and deaths have been 4,300, even after almost 2 months of complete or partial lockdown. So the question is what to do about it. But this is not new. We have seen some form of pandemic before also, plaguing our cities from in the last 300 or 400 years. For example, 1665 plague. We see that, of course, poor has been most affected all the time. But this is the time to think about what cities have learned, how they have reacted, how they have responded, and how we can learn from those reactions to counter future pandemics. So, for example, the cholera pandemic in the 19th century sparked the introduction of modern urban sanitation system in Britain. Okay, this is a planning issue. Housing regulation around light and air were introduced as a measure against respiratory diseases in overcrowded slums in Europe during industrialization period. In the case of plague in London in 1665, minor improvements were made to the city spaces. Streets were widened, pavements were created, open sea were abolished, and all these things. However, there has been one thing which is common in all of this. We have always reacted to or have adapted to situation. Now, for once, this is the time we should strive to embrace proactive planning. We should design our cities and accommodate most vulnerable of our population accordingly. It's now this needs to stop where we simply adapt and react to the situation. We know we have technology, we have science with us, and we know that we can predict these kind of things now. It's just that there has to be a political will to do this. Also, over the years, especially in last 10 years, in India especially, we are trying to make our cities smarter. In world, of course, it's going on, but India also in like 6 years, not 10 years. So there has been official push, government push. We are trying to make our cities smarter. And we, as a part of this ecosystem, need to find solution that ensures that these cities are also resilient for future pandemics. And how do we ensure that? The individuals of a city, and especially the poor, are provided a safety net that can help that overcome the challenges that a crisis like this might pose. And we must also realize the core of how each and every individual in the city matters, and how this interdependency is something that we cannot take for granted anymore. So these are some of the thoughts, and of course, we would like the panel and the presenter are also Professor Soumyadeep is also going to talk about some of these issues, and of course, the panel is going to take over this. But I just wanted to give some of the opening remark after excellent remark by Chris. So, and also I would like to introduce our panel. So first of all, let me talk about Chris. So Professor Silver is of course chairing this webinar, and Chris is former dean and the professor at the College of Design, Construction and Planning. Chris has served at 3 years as Urban Development Advisor to Indonesia. And he is a planning historian focusing on planning and decentralization, contested space in Global South. And he has written, I think, 6, and now maybe 7 books and numerous articles. Also, one thing about Chris is we always talk about his second home. It's not in US, it's in Indonesia. He has been to Indonesia, I think, more than 50 times. He simply loves that space. I've been to Indonesia with him, and he knows more about Indonesia, about streets, about food, about culture, about history than many local people. So he is in simply love with that city. So his perspective, the perspective of Indonesian planning, he has been to India many a times. So, and he is an avid learner. So his perspective, international perspective, given that his background as a planning historian, is simply unmatched. So we are very, very thankful for him to be here. Also, we are very grateful to have a very esteemed panel. I cannot think of a better panel to deliberate this timely and serious topic. We are thankful to Professor Wendy Olson from the Department of Social Statistics at the University of Manchester. Wendy focuses on the sociology of economic life. She has extensively studied Indian labor market and credit market for poor, and she is an excellent person to deliberate on this discussion. We also have Mr. Sandeep Mishra. He's an executive director at ActionAid Association India and co-chair at the World Urban Campaign, UN Habitat. He is a social anthropologist by training and a development activist who has lived and worked with indigenous people and Dalit communities in India. He has worked in several capacities in ActionAid International and other development organizations for the last 2 decades. And he's also working on developing the South Asia process for the World Forum of Alternatives. We also have Professor Ruth Steiner from the Department of Urban and Regional Planning She's my colleague, and she is the director of Center for Built and Health Environment at the University of Florida. She's one of the leading voices in transportation planning, and also one of the very few people who has stressed enough on how health and built environment can have profound impact on the human and the social life. Also, I think I have learned one very important thing from Ruth. It's about how access is important, how opportunities, access to transportation is key to the success. And I think I owe Ruth, because she has taught me the importance over the years, because I'm very grateful. She's my colleague, and we have had these kind of discussions a lot of time. And finally, I'm convinced that, access is really very important. It provides the opportunity. This is the key. We also have Dr. Arjun Kumar. He is Director of Impact and Policy Research Institute, IMPRI. And as I told you, a very relentless guy, amazing researcher, very productive researcher, and he's a good friend. So now I'm not going to delay. I'm not going to be coming in between Dr. Soumyadeep Bhattacharya Chattopadhyay, who will be presenting the finding of this study. And Soumyadeep, all yours.
So thank you, Chris, and thank you, Abhinav. Just a little bit of housekeeping. Can I share the screen, my screen?
Go ahead and try. If not, I'm going to make you host.
Okay. A very good evening from Kolkata to all of you. Just let me first share my screen. No, it's written that host disabled participant screen sharing.
Okay, then I am going to make you host.
Okay, fine. Yes,
now you're the host. Try
yes.
that.
Yes. So is it okay?
Yes, perfect.
Okay. So yeah. So as Chris and Avin have already mentioned that due to the COVID-19 pandemic, we are witnessing a humanitarian and economic crisis of unprecedented proportion. So whether it is Wuhan in China or New York in the United States or Mumbai and Delhi in India, it's the dense urban and peri-urban areas have been the worst hit, and more specifically, it is the urban poor who have borne the brunt most. And there is no saying when the COVID-19 curve here in India will flatten out, but the economic curve already has. And the policymakers face an impossible trade-off between saving lives and livelihoods, and that too with a painful urgency. And Indian cities, it's the fact that the lives and livelihoods are truly interwoven in a complex way. Now, this study specifically focuses on the city makers of India. And the city makers here are the urban informal workers who represent a share of the workforce and contributing multiple ways to the economy in cities and making the cities. The National Commission for Enterprises in the Unorganized Sector 2009, it mentions that between 94% to 98% of the workers belonging to the poor and vulnerable groups were informal workers. And another study reported that these workers contribute almost 50% to the national income of the country. And the major sources of the employment are in the construction sector, the petty retail trade, small businesses like selling tea, selling vegetables, tea, etc., and low-paid work as domestic workers, drivers, peons, etc., etc. And this unorganized sector plays a crucial role in providing sources of livelihood to the workers, especially to the rural migrants and the low-income households residing in slums, quarter settlements, and in homeless shelters. Now, most workers in the informal economy have certain common constraints. They have no written job contracts and are often employed casually through job contractors or temporary agencies, and they face multiple barriers in pursuing the livelihoods for example, via the policies and practices of the governments, their deplorable housing condition, their inadequacies of urban services, and so on. And apart from this problem, urban India also sustains a kind of inbuilt socioeconomic disparities with respect to caste and gender. And even in normal times, they create unacceptable levels of deprivation for the majority of the urban dwellers. Now, on this existing base of human well-being, this lockdown has come as a body blow. While the total shutdown was necessary to mitigate the impact of a highly infectious disease for which there is yet no vaccine or cure, its impact, as this survey would show, has disproportionately hurt those sections whose coping mechanisms have already been rendered fragile. Any crisis or disaster, let alone a pandemic of this magnitude, throws the working urban poor into the further cycles of deprivation. Now, there have been some insightful media reports and some valuable institution-led surveys in India on the plight of the poorest section of the society, particularly the migrants who have lost their daily wages and now are dependent on the government and the non-government support for meeting their daily needs. However, we do not know much about the experiences of the low-income families who are the city makers amid this COVID-19 crisis. A key lacuna is maybe the total lack or very limited availability of data. Now, our study contributes to this body of literature by drawing on the data we were able to collect from 3,121 respondents, covering mainly the informal and unorganized workers in 50 plus cities of India. And the study was conducted and coordinated by the Impact and Policy Research Institute in New Delhi in association with the Center for International Design and Planning, University of Florida. And we have also received voluntary support from ActionNet India, Outline India, and numerous local NGO partners, to name some of them, like Manav Dhara in Jharkhand, Asha, Sandeep Mishra, Medical Social Servant Society in Delhi. And also we interacted with several academic partners from reputed higher education institutions across the country to conceive and conduct this study.
Soumyadeep,
Yes.
many people can't hear you, it seems, properly. They can hear you, but they can't hear you properly. If you can be close to the mic, or if you can speak louder, that's one. Second, also, can you please go ahead and go full screen? That way, people who are on small devices can. Okay, can you go full screen? Because people who are in small devices are having particular problem. Yes, no, full screen. That's the full screen. Okay.
No, not that. Sir, in view option, in view. Full.
Yes.
Perfect.
That is perfect. And just please make sure you talk to, I'm sorry to interrupt, but people can't hear you, and that is, we want to avoid that. Thank you.
Am I audible?
Yes, to me, yes, you are. Yes. Go ahead.
Well, so the objective of this study is to understand.
No, Soumyadeep, you're not audible. I don't know what happened. Can you check your connection?
It's good. Try again. Yes. Soumyadeep, sir, please go ahead. Try again. Yeah.
Is it?
There is some disturbance. I think,
Actually, this may be actually we have some storm right now outside.
Okay, the storm. Okay, possibly.
It's maybe it's because of that. I'm not sure.
Oh, great. Let us go ahead. We will fix it. Yeah.
Okay.
Should I go ahead?
Go ahead. We'll try again, and if needed, I'll interrupt you once more.
Okay, fine. Okay, I'm just going a little bit slowly.
And one more thing, if this doesn't work, somehow your voice is not clear, we'll try to go, you can go ahead and stop your video, so that connection generally improves with that.
You could put your mouth right next to your microphone, please.
Is it okay?
Right now it's okay. Yeah, go ahead.
Okay, fine. So the basic objective of this study is to understand the impact of COVID-19 and the unprecedented lockdown on normal life and work of the CityMakers. Okay. So the first set of questions relate to the respondents' access to basic services like water, sanitation, etc., which have crucial implications for daily practicing of basic preventive measures. Secondly, we inquired about the immediate concerns regarding the health and education related aspects during the COVID crisis. Thirdly, we tried to understand the CityMakers' pandemic awareness and their perceptions regarding the practice of basic preventive measures in the neighborhood. Fourth set of questions were related to the impact of lockdown and on work and livelihood. These are on the kinds of jobs that have been lost, their livelihood to resume work, etc. And next, fifthly, we inquired about the emotional well-being during the crisis period. And our sixth set of questions related to how the basic needs of the households are being met during the lockdown. The state and central government have responded with various measures to mitigate the economic hardships, such as food or cash transfers directly into the bank accounts and so on. So how effective these policy responses are in terms of awareness as well as access to them by the CityMakers. So who is covered under the schemes? To what extent are people able to access and use the different schemes, and what obstacles exist? So these are some of the questions which we're going to deal with. And regarding the regarding the study methodology and design, we have conducted the telephone service during 7th to 17th May 2020. Now it is very difficult to make a phone survey representative because there are problems related to limited access to phones and so on and so forth. Now to address some of these issues, we drew on the existing databases of the previous studies conducted by IMPRI and the contacts provided by its NGO partners. We contacted the potential respondents, and from whom we further identified the respondents with the support of local NGO, community leaders, and other.
Soumyadeep, again, I think we have lost your voice completely. Hello, Soumyadeep?
Hello.
We can't hear you at all. Okay, so actually there is some storm going on right now in Calcutta, and that is impacting the internet connection or the connectivity.
Yeah, so that's why maybe the internet connection is unstable.
Yes, I think he can be on the phone. And Soumyadeep sir, you can make Abhinav sir the host. Okay. Yes, and you can speak here. Is it all right?
So should I speak on the phone?
Yeah, it's better. Yes.
You can connect via phone also.
Yes, he's on phone already.
Okay.
Okay, sir, go on.
Okay, so is it fine?
Yes, fine.
Okay. Just let me have my earplug, please. Hello, am I audible?
Yes, sir. Zoom is fine.
Yes. Zoom is fine. Actually, yes, I'm really sorry.
We can hear you. Yes, go ahead, sir.
Hello, I'm really sorry. Actually, a storm is going on. So maybe that's why the internet connection here is a bit unstable.
Not an issue, sir. We can hear you. Yeah.
Okay. So here the results that we are going to present are shown at an aggregate level. But we also have a plan to examine city-specific aspects of and responses to the lockdown. Okay. And This is our coverage of the study. We have covered 50 plus cities from 20 major states in India, and the total number of respondents is 3121, and 34% of our respondents are from mega cities, Delhi, Mumbai, and Kolkata. And in the next slide, we have some demographic features of the respondents. For example, this is the age of the respondents, education level of the respondents, and the gender of the respondents. So these are all self-explanatory in nature. So let me move to the next slide. So this is related to the access to basic services. Now, the World Health Organization's guidelines for protection against COVID-19 are simple and basic. They advise people to wash their hands frequently with soap and water, practice social distancing, and stay home. However, many of the recommendations assume basic living conditions and access to essential services. Unfortunately, in India, for example, accessing water is not as simple as turning on the taps in the kitchens and toilets. And this is, in fact, evident from this survey. Among our surveyed respondents, only 48% have access to tap water and piped water supply. Thus, nearly 52% of the city makers have no access to public supply and have to depend on other sources of water, and basic hand washing remains out of their reach. And there is an added problem of intermittent water delivery. In fact, the water consumption is mediated by the amount that they are able to access from this unpredictable daily supply, and not by the amount that they actually need. And as a result, so our respondents, they have no other option but to arrange for some kind of self-provisioning. For example, they're using the tube oils or hand pumps or access water from private mobile tankers and so on and so forth. And each of these entails significant cost on the part of the households. And this problem has only become harder for them as the work opportunities have dried up. We will see this thing in the in some of the later slides, have dried up in the wake of the extended lockdown. Now, regarding respondents' access to latrine facilities, we are seeing that nearly 23% of them, they either use community or public toilets, or open defecation takes place for them. Now, lack of access to sort of exclusive latrines has made it difficult for the respondents to follow good hygiene. And also we are seeing that nearly 1/3 of our respondents, they reported improper drainage facilities in their localities. Similarly, in case of disposal of garbage, we are seeing that almost 30% of the respondents, they reported the use of a common place for disposing of their garbages and all these things. Now, all this can lead to a serious health problems, which may reduce citizens' immunity and make the whole communities susceptible to further diseases. Now, COVID-19 has clearly demonstrated that safe access to safe water and sanitation are crucial to saving lives. Now, this lack of basic amenities makes the less privileged sections of the Indian societies practically defenseless against COVID-19. Here we are discussing some of our respondents' access to basic necessities during the lockdown, and we are seeing that majority of the respondents, they personally reported that they could access some of the basic necessities, but at the same time, they mentioned that such access was inadequate, and they have also mentioned some of the reasons why they actually think that their supply of those things are inadequate, and shortage of cash or hike in price or lack of supply. These are some of the major reasons behind their inability to access or their difficulties in accessing these basic necessities. Now, this is an interesting slide. So here we are seeing that like one of the preventive measure of prevention of COVID-19 is to keep social distancing. But we are seeing here that on an average, in non-notified slum and unauthorized colonies, 3 to 4% they reside in one room. Now, this obviously led to congestion and practically made the practicing of social distancing impossible. Next, we have also inquired about the immediate education and health-related concerns, and we are seeing that the 51% of our respondents, they reported to send their children to government schools or colleges, whereas 36% of the respondents, they depended on the private educational institutions. And we know that during this lockdown period in India, online teaching has become the new normal mode. So when asked about the problems that they faced in pursuing their educational activities, 62% of the respondents' children studying in the government school reported to have lack of device and non-availability of information from school as the major stumbling blocks. And obviously the corresponding figures for the private schools are a bit less. And regarding the access to health, almost 3/4 of our respondents reported the availability of government or private healthcare facilities within 2 kilometers of their residence. However, there are two important concerns which we should take note of, that nearly half of the respondents. Hello.
Yes, go on, sir, please. Yeah.
Okay. So there are two important concerns. First, nearly half of our respondents reported that either they seldom visit health center or visit only when the health condition is critical. And also about somewhere about 88% of the respondents, they reported to depend on their household income or savings or borrowing or taking financial help from the relatives and friends for meeting their health-related expenditure requirements. Now, interestingly, we all know that this virus is unknown and it's difficult to distinguish its symptom from that of common cold and fever. So, given the possibility of asymptomatic carriers of coronavirus, this respondents' infrequent visit to the nearby health center that might result in transmitting the virus to a lot of people. Now, also, another thing is that any kind of health emergencies would further exacerbate their already weak financial position and also make them more and more vulnerable. Now, we also have inquired about the preparedness for this COVID-19 pandemic. So we are seeing that television and word of mouth, they actually emerged as the two most important sources of information on novel coronavirus for majority of our respondents. And also we are seeing that in terms of adherence to the personal hygiene and social distancing norms, both at the individual level and also in their locality, quite a significant proportion of respondents, they reported to follow some preventive measures. Now, we are making this survey during the lockdown 3. So this could be due to the higher awareness through the information flows and a fear, obviously a fear of the unknown diseases. And importantly, only 47% of the respondents were hopeful that social distancing would be ensured in their neighborhood after lockdown. Now, this may be due to the fact that the perception of respondents and their household members getting infected has gone down substantially. Now, this might have made respondents more complacent about their practice of preventing measures. But we need to be cautious, because with an expected increase in infection rates as the lockdown eases and social and economic activities resume, there is an urgent need to continue to sensitize this population on the social distancing practices. And next come to the very crucial part, which is the impact on work and livelihood of our respondents. And the findings are very interesting. We have found that the majority of our sample, in fact, almost 3/4 of our workers, they are engaged in informal employment. Now, this is the demographic group that is particularly vulnerable to economic and health shocks due to the irregular nature of their work and daily wage payment based on their work schedules. Now, even among the salaried workers, if we see that 40%, 45% of them work in temporary or contractual mode. So we are seeing that almost 61% of the surveyed respondents, they reported that they lost job due to this lockdown. And this incidence of job loss is greater for the casual laborers. Almost 4% of them, they have lost their jobs, and 67% of the self-employed workers, they also have reported to lose their jobs. And when asked about the reasons for unemployment or loss of jobs, quite a significant proportion of surveyed respondents, they cited their inability to visit workplaces or the closure of places of works as the pressing reasons. Now, this is very interesting, because the very nature of the jobs in which they are engaged practically preclude any possibilities for them to work from home. And next come to this, their livelihood after lockdown is lifted. So what we see that their loss of jobs, all these entails a massive shock to the livelihoods and wage earnings of the respondents and their families. In fact, In fact, we have seen that the 43% of the respondents, they reported that they were stressed due to the loss of livelihoods. So quite expectedly, then the most people wanted to return to work. We have seen that when asked if the respondents and their family members would resume work after lockdown, we have seen that almost 3/4 of the respondents said that they would join the same work in which they are engaged prior to the lockdown, or they will look for the employment. So obviously they can't remain sit idle in their home, as this is their biggest challenge. And next, we have considered the mental well-being of our surveyed respondents. And actually, there are evidences that high level of emotional stress across the world as a result of this pandemic. So this is very crucial. We have found that 62% of our respondents, they were anxious or worried, and 56% of the respondents, this anxiousness was directly related to some more fundamental concerns of financial well-being. Okay, and for about 40% of the respondents, there is some stress about access to essential services, medical care if required, and so on and so forth. And only 46% of the respondents were worried about getting infected by the virus. And we have a silver lining, a sort of kind of thing, like on a positive note, we are seeing that 62% of the respondents, they believe that they have been able to reconnect and communicate with the family members better during this lockdown. However, overall, what I would like to mention is that the psychological impacts appear to be quite significant, and one can expect this to worsen. This is a very crucial thing if the hopes of regaining work and employment are not realized as we move beyond this recovery period. So this is very, very important. Now, regarding the linkages and access to the public schemes, we have first examined the people's access to some of the basic documents, because as we know that the central and the state governments already, they have announced a slew of measures, both cash and non-cash, to support the poor people during this lockdown. However, access to many of these assistances crucially depends on the position of government documents, for example, ration card or Aadhaar card, or having a bank account, or enrollment in different government welfare schemes, and so on and so forth. However, it seems here that the coverage is a major concern, because we are seeing that about 23% of the respondents, they did not have any ration card. 32% of our respondents, they did not have a bank account with their Jan Dhan. And most interestingly, the Ayushman Bharat, India's flagship public health insurance or assurance scheme, only as high as 32% of the respondents, they were unaware, and 57% were not simply enrolled. Similarly, coverage is a big issue for the other two life insurance schemes, namely the PM Prime Minister Jivan Jyoti Bima and PM Suraksha Bima Yojana. So this is a serious policy concern, I think. And also, we have seen that the central and state government, they have introduced several portals and apps during this crisis, and we tried to examine the respondents' awareness and use of such portals and apps. And we have seen that, for example, this Arogya Setu app, 65% of our surveyed respondents, they were aware of the Arogya Setu app, and among them, only 62% are using this app. Okay. And for other apps and other initiatives, if we just look at the percentage figures, the awareness levels of our surveyed respondents are very poor. Roughly about 20 to 30% of our respondents, they were aware of some state e-coupons for ration, the state e-pass, or other different state apps. And unfortunately, the use of these apps among them turned out to be even quite pathetic. And regarding the financial and non-financial assistances, we specifically focus on 5 major welfare schemes that are being used as channels to provide reliefs. And these are Prime Minister Garib Kalyan Yojana. This is a special relief measure to mitigate against the economic losses suffered by the poor due to this coronavirus pandemic outbreak. PDS rations, which is basically the free provision of food grains. Advance payments of pensions, that is the cash transfer. PM Ujjwala Yojana, that is the free LPG cylinders. And also there are some provisions for direct cash transfer, for example, ex gratia payments in Jan Dhan Yojana account owned by the women and something like that, something like this. And here we inquired about the respondents' eligibility, their awareness if eligible, and whether they received any assistances with regard to these 5 schemes. And here also the responses is quite a concern because only 30. For example, if we consider the PDS, the free ration, we are seeing that only 64% of the respondents thought that they were eligible for free ration, and among all of them who were aware about the provision of free rations, in fact, almost all of them, they were aware about the provisions of free ration. But here also, the proportion of respondents not availing any benefits or receiving less entitlements were quite significant, and the percentage figure is almost 36%. And also, we are seeing that for example, for direct cash transfer, more than 55% of the respondents, they reported their ineligibility. And also among the respondents who were eligible and aware, only 55% of them, they reported to receive some sort of direct cash transfer. So overall, it appears that the lack of awareness and eligibility are the major impediments for these city makers. And this coverage of different government schemes is far from being universal, and the help from the government during the lockdown have been anything but inadequate. Now, it is not quite therefore surprising that a significant proportion of respondents, they are not being able to get nutritious food as they had before the lockdown. And when we inquired about them, I think we do not have that particular slide, but this is an interesting information that when we inquired about them, that why they are not being able to get nutritious food. So they mentioned that lack of cash, increased prices, and shortage of essentials. These are the major problems behind this. And among our surveyed respondents, 28% of them, they received, they were able to receive assistances from NGO in the form of free ration supplies, cooked meals, masks, etc. So what comes out from this slide is the fact that it is very important to ensure that the government supports are sufficient, are accessible, and are usable during this crisis. So bridging the awareness gap through timely and reliable information, or expanding the coverage to the needy but non-registered segments via certain temporary forms of, say, authentication as alternatives can be very useful. And next, we have listed down some of the pressing needs or assistances as mentioned by the respondents both during the lockdown and after the lockdown. And these are the figures which we'll see that that the medical assistances, groceries, the subsidized household supplies, vegetables, cash transfer, these are the major problems that they face. And after lockdown, respondents would need access to free food or ration, livelihood opportunities, their cash, their access to affordable healthcare facilities, and so on and so forth. And here, this is an interesting thing that in the last year's economic survey, it actually introduces the concept of thali economics, which actually quantifies that that a common person should pay for a veg plate for ₹25, and a non-veg platter they can get it at ₹40. However, if we see the financial provision for all the schemes which have been announced here, for example, in the so these are not very much. This is not possible for the city makers to access this veg platter or non-veg platter as at ₹25 or ₹40. So the financial assistance is quite inadequate. So what we need is that here we may think of $1 per day and an Android phone, because these are the financial outlays. And we also think that the direct cash transfers of around 2,000 rupees that could be necessary. And also we need to sort out, or we need to plug in the leakages which is there in the PDS systems, and so on and so forth. So these are some of the things. And also we asked specifically the respondents about the two most pressing challenges which they reported in their battle against COVID-19. And this is the word cloud, and it says that the lack of employment and the lack of food supply. So these are the two basic or the two pressing concerns reported by the respondents for their battle against COVID-19. And So and this is also the same kind of thing. When we asked about the perception and opinions, we are seeing that the unemployment and the lack of livelihood opportunities, this is the most pressing concern, and also followed by the stress and contesting for basic resources and all this, and stress, anxiety, and rise in mental well-being issues, and so on and so forth. So let me now summarize all. If I just try to point out some of the key takeaways, mainly 5 takeaways we can think, or we can mention from here, broadly. So first is that more than half of the respondents reported that they were unemployed due to the lockdown, but the impact has been greater for the casual workers and the self-employed. And second is the limited access to safe water and private toilets. These adds to the public health challenges. Therefore, for a significant proportion of the city makers, complying with these norms of social distancing or regular hand washing, these are privileges or luxuries kind of thing, which they simply cannot afford. And secondly, it seems that a sense of complacency sets in among the city makers in practicing the preventive measures due to the fact that the perception of respondents and their households member getting infected has gone down substantially during this lockdown period. And another important point is that the coverage of different government support schemes is far from universal, and lack of awareness, eligibility are the 2 major impediments. And most importantly, from our survey, it is evident that while facing the trade-off between health and economic well-being, city makers emphasize more on the latter. Survival is their first priority. Everything else takes a backseat. And just we have mentioned some of the broad policy takeaways. So we need, so just if I summarize it very quickly, so we need a range of data on basic demographic data, their health status, economic data, livelihood. These are required for epidemic response planning because we do not know nothing. Much of this data is typically missing on city makers living in informal settlements, at least from formal data sources in India. So what we need is local periodic data are essential for pandemic preparedness and response. And secondly, so far the experiences of the policy implementation, what we are getting is that the greater decentralization is badly needed. It is important to bank on the people. For example, the elected representatives at the local level who know the people they represent, the diversity that exists in their wards, the lowest level of urban unit in India, the resources that can be mobilized at this time. So it is crucial to allow them to decide on the delivery systems that might be most effective in their context. So let us acknowledge the fact that the crisis of COVID-19 demands an extremely localized and coordinated response. So it is an opportune time for us to acknowledge India's constitutional structure and financially empower the city governments with clear functional domain and adequate institutional capacity so that they can face this overwhelming challenge. And urban planning process that also need to be more dynamic, taking into account the employment projections, especially those related to the informal employment. And also from our survey experiences, it is evident that the city makers, they emphasize more on economic well-being. However, as we have seen that majority of the economic proposals of the government, they share a common feature of insistence on targeted direct transfer to individuals. However, in India, there are growing evidences of exclusions and omissions, payment failures, and misdirections, even in normal times for these schemes. So in this context, one option could be to think of some kind of job assurance program as one of the longer term policy options to address the looming economic crisis. It would give the needy households livelihood security during these bad trying times. And also it is extremely important to improve and expand the coverage to the PDS. It is important to think about certain temporary measures to identify and distribute ration for non-registered PDS individuals. So this is very crucial. And in fact, the city makers should be allowed to prove their identity through any means available to them, to access government schemes, at least for the next 6 months. And last but not the least, what we see is that despite the enormous contribution made by these city makers in building our cities, there is a scant recognition of their presence and acknowledgement of their unique needs. And under most of the urban development plans and programs in India, every individual, they has to prove their domicile status in the city to be eligible for a wide range of urban public services. For example, access to individual water connections are based on house ownership or proof of domicile in the city and in the settlement itself. So there is an immediate need to incorporate all these city makers, the informal workers, under the purview of government's flagship programs and policies. Any solution, for example, for the provision of basic facilities, which are extremely crucial to prevent this spread of pandemic to the city makers, including the migrants, need to be legally mandated in some sense. And in essence, the vulnerabilities to the COVID-19 are immense for the city makers, and control measures like lockdown risk further harms. So mitigation of both must start with the inclusion of these city makers and their relatives in urban planning processes. So this is extremely crucial, because then only we can build cities which are inclusive, as well as the cities which are truly smart in nature, in conformity with the objectives of SDG 11 and the United Nations Urban Agenda 2030. So thank you for your patient hearing. Thanks a lot.
Thank you so much, Soumyadeep. And just to remind,
you can come to the last slide. Yes, go ahead, Abhinav, sir. Yeah.
So thank you very much for your presentation. And just to remind everyone that actually in Calcutta, where Soumyadeep is based, right now there is a storm going through.
Yes,
so
I'm really sorry for that.
Yeah. No, I mean, you can't do anything about it. But thank you very much for a wonderful presentation. And also, just to remind our participants that through this survey, we reached about 2,800 households, which means about 14,500 individuals. So I would say at this point of time, as far as I know, this is one of the biggest survey undertaken during the lockdown 3.0. And definitely the idea is we are going to continue this work, because as a researcher and as a student of social science, I think it's our duty to report. It's our duty to report, and also to make sure, deliberate on how people are. For example, if we have followed them at 3.0, we would really like to follow up, create a panel later going on next month, how they are doing, or next to next month, because this is not something, their life have been profoundly impacted. They have been uprooted. Many of them have uprooted from the cities. So what I'm going to do right now is also, I would really like to thank our young volunteers, the students who were very, very effective in gathering this data. Without them, simply it was not possible. We had army of students working on this project. So what we are going to do is I'm going to invite 3 students to talk about their experience just for 2 minutes each. Their time limit is about 2 minutes. So we are going to hear from 3 selected students out of many who have worked. And I'm going to make them panelists. Just bear with me for a second. So the students are Ria Saha, then we have Shreya Pal, and then we have Shribanjan Datta. This will take a minute. I think they need to join again as a panelist. Okay, so if you can switch on your video, guys. Okay, so how about this? Let Ria go first, and then we'll have Shibanjan, and then finally Shreya. Ria, please go ahead. Your mic is muted.
Yeah, I hope I'm audible.
Go ahead.
Oh, okay, I hope you're all doing safe right now. I'm Ria Sahab from University of Delhi. I joined as a volunteer in this telephonic survey by IMPRI. I conducted this survey over a total of 40 respondents in the Delhi NCR region. This experience had really helped me in getting a lot closer to the real life experience of the migrant workers. So today I'll share one of those experiences of the respondents. The respondent as a domestic servant earns rupees 12,000, that is $158, which is very sufficient to match basic needs of a two-member family in India. Even so, during lockdown, life completely turned upside down for her. Her husband, daily wage worker, became unemployed during lockdown. Many houses had stopped paying her the full salary, leaving them with only around half of the income they usually receive in the month. She was notified by the landlord that they had to pay the full rent of rupees 3,600, that is $48 for the month, or vacate the house. The price of essential commodities often hiked in the nearby Bengali market. I'm assuming due to the supply constraints. There was no form of assistance from any government or private organizations which had yet reached the locality. Like her, there were around 1/4 of respondents who had no access to Arogya Setu app due to lack of technologies like internet and smartphones. At the end of April, her income got exhausted and her savings started to dwindle, due to which they finally decided to go back to the village in West Bengal in the first week of May. With no tickets for Shramik special trains available, they had to buy bus tickets, which had cost them rupees 15,000 in total, that is $198, which is much more than a normal monthly salary. However, coming to the bright part of the survey, many people had also offered them food during the bus trip to West Bengal. In fact, around 60% of the respondents claimed that they had generally received help from individuals and organizations. I also observed that a lot of respondents were still optimistic and strong even after the vulnerable conditions, which becomes very crucial during these uncertain times when they are unaware of what the future holds for them. With this, I would like to end. Thank you.
Thank you so much, Ria. And can we, Shibanjan, right? Yes, Shibanjan, can you go ahead and talk about your experience?
Yeah, so greetings everyone. First, thank you IMPRI for providing me the opportunity to witness the ground level reality. The surveys yielded results much consistent with the apparent causality of the incessant migration that has been taking place. Now, there exists a clear lack of basic amenities to sustain life, which also encompasses the ability to maintain precautionary hygiene during the pandemic. Now, some of the people reported receiving government support, but unawareness and inadequate provisions turned out to be a great issue. In some cases, they complained that they had no documents, and some didn't receive the full amount. And some complained that the whole distribution process had been rebranded under a local political banner, thus altering the whole mechanism. Now, speaking about unemployment, the huge loss was sometimes originated from the breakdown of informal contracts, but mostly it was due to the inability to conduct their own or their employer's business. Now, the pool of unemployed often turned to other sources of income, such as selling essentials, vegetables, fish, etc. Now, this might be a plausible reason why the prices of essential commodities such as vegetables at least stayed low in Kolkata and adjoining areas. Now, another important observation turned out to be that the women of the house often turned out to be the sole breadwinners of the family, because mostly they were housemaids and they continued receiving their payments. Furthermore, the small businesses or microfinance companies, which remained optimistic of resuming operations, continued to pay their wages, which reduced the burden of the laborers but increased the vulnerabilities of the businesses failing, and which, if happened, would lead to further catastrophic results. Now, we can't simply afford the plight of our city makers. The recent storm Amphan, which hit the eastern parts of India, including West Bengal, indicated this clearly. When many people crossed the threshold of sustenance, and government had to themselves acknowledge that the shortage of manpower was there to make things better. Now, I interviewed a person who was on the verge of migrating to other state at Bihar, and she could only stay back because her employer offered her the required food and shelter. Furthermore, the voluntary food distribution stalls and the local gurudwaras provided food, ensure that the whole area didn't go hungry. Now, in these are trying times, now when formal institutions grow, teachers are the one which goes the long way. So thank you.
Thank you, Shibanjan. Thank you very much. And Shreya, up to you, please.
Hello, everyone. I hope everybody is doing well. First of all, I would like to say that it has been a pleasure to be a part of this extremely significant ground level study where we brought into focus the plight of our city makers during this lockdown. Throughout this survey, I've encountered many interesting stories that needed to be shared, and here I would like to share two of them. So there is this woman who is living in a slum in Kolkata. During this lockdown, she lost her only daughter in an accident, and she had to remain in a hospital for 2 days while trying to save her. When she returned to the slum, people, instead of showing her any sympathy, turned against her, and a few even said that since she has been to a hospital, she must be having the coronavirus, and asked her to leave the slum. Her husband, who is a laborer in Patna, Bihar, also couldn't come and meet her. Also, during this difficult time, she couldn't avail the free ration being provided by the government because she did not have any ration card. She said she didn't receive any government aid, but few NGOs helped her with providing 2 kgs of food grains, a few kgs of potatoes, and a bottle of hand wash. I also have been able to reconnect recently with one of my earlier respondent who already used to live in a congested slum-like locality in Kolkata with 5 of her family members. And when a terrible cyclone Amphan hit the city on the 20th of May, her shelter was destroyed, and since then she's living with her neighbors who were generous enough to let them in. And for days they were staying without electricity and water, and maintaining hygiene and social distancing norms were extremely difficult then. These people are unlikely to go and test themselves for the virus because of fear of social isolation and awareness, and also because testing facilities have been so poor in India. Ending on a good note, some people have really been optimistic and cooperative during these times, and trying to maintain social distancing and hygiene, etc. I've also heard stories of people sewing masks and distributing them among their locality members. So overall, I think I can say that the darkest times are beyond us, and we can all hope for things to get better. So thank you.
Thank you, Ria, Shibanjan, and Shreya. I think this is very important. This is some sort of in the era of technology, we are reviving the culture of the field notes, and we are trying to come up with a video diary of field notes, which is very important. Of course, after many years in the profession, I understand the importance of it. And you guys are just starting, and you will understand how important this is to have field notes and talk about field notes, because they are your real asset. They are their experiences. And thank you very much for providing us, enriching us with these details. Okay, so now we are.
Also thank Dr. Abhinav Alakshendra for guiding all our field student researchers, and also bringing this important aspect of sharing the ground experiences. And I congratulate all the 3 students for being very bold and coming here to speak. In fact, all of them. I think in the interest of time, we should quickly go to the panel discussion. Dr. Abhinav, yes.
Exactly. Okay, so now we are moving to panel discussion, and students, I'm going to make you attendees again in a minute. So I'll open the panel now. So now for panelists, we have Professor Steiner, Professor Olson, Dr. Kumar, and Mr. Sandeep Mishra. So please go ahead. I can pose a direct question, but let's start with the presentations. We have a presentation we heard, and also if you want to comment on the student presentation, like the video diary from the field. So let's start with that, and then I will have some pertinent question for the panel. So please go ahead, and Wendy, if you want to start. Wendy? Wendy, can you hear me?
Yeah, sure.
Okay, so do you want to start with a general comment on the presentation first, and then we'll move to specific questions?
Yeah.
Please.
Yes, thank you. I see that people have put a lot of questions as well, so we'll try and come around to those. I liked the presentation very much. It was very clear. And I liked one phrase. I would repeat the phrase. We need an extremely localized and coordinated response. So here in the room, we have these people who are focused on the coordination. I would like to focus on the idea that it's extremely localized. So I don't find so much need for a total distress approach to this, because people are doing their daily caring. So my idea on this is autonomy. That's the local autonomy, caring for how we quarantine people and isolate people and, hygiene. But that's obviously happening. And then basic income. So it's ABC. We need the basic income coming as a secure income to everybody. And I don't really hear the government guaranteeing that, but the ration shop managers could be encouraged to give more guarantee. That is, if you don't have the right papers, we will sort this out for 6 weeks, 12 weeks. It's a long term. So if they could please sort it out as basic incomes. Actually, Indian government should give basic income, a guaranteed income for everybody. And they can do it. They have that facility. That is the coordinated response. So please, could they start that cash supplement immediately? The third thing is ABC is caring. So in the households, the caring is going on. Now, this is a big change. And I think your survey is catching the idea of the government facilities, but maybe we also just need to look inside our households at the changes in the household. When the person is
Wendy, we can't hear you.
not even working on messaging in regard to caring for elders, while we have this time. So I think there was a comment in the survey about stigma. We need to remove the stigma by placing ourselves in a position of dignity. So I felt very much in tune with the survey, which did give a lot of dignity to the respondents. Now, the students have so nicely given these small extracts and stories. I would stress that the domestic workers employer is that householder. Domestic workers employers should give at least 3 months' wages flat out. Just give that money. I hope they did it. That is their duty as an employer in this situation, not lending. So thank you.
Thank you, Wendy, so much. Sandeep?
Okay, first of all, gratitude to all the student volunteers. It's lovely to see you doing it, and congratulations. Thanks to the researcher, very nice presentation, Dr. Soumyadeep, and of course, colleagues at IMPRI and the University of Florida and yourself, our host today. So lovely research. Very good to know that this is reaching out to roughly 14,000 people. So it does make it one of the largest. If we go by head counts, the other ones have been around 5,000 in India. And I want to make 2 or 3 broad comments to begin my intervention, and then we can follow up later. And I'll try and address some of the questions which have also come alongside the basis of the survey. First, I think what we are witnessing is not just about the question of COVID and the impact of COVID on informal workers. So what we are witnessing is an unmasking, a historical unmasking of the world of work for informal workers in India and more generally in the world. So I want to make it clear because solutions come from there. So what this disruption has done is a massive disruption, no doubt. It's cruel. Actually, it's very, very cruel. I work for ActionAid, and my team today has already reached out to 2.7 million informal workers, migrant workers on the highways of India with relief. And we're also doing a massive study which will go in mega numbers. But that aside, the tales are cruel, the times are cruel, the scenes are horrible, and I think one almost wants to rebel looking at what is happening to the makers, not just of our cities, I think the makers of the nation, of all modern nation states, and how they have been treated. So in some ways, this is an unmasking which was always there, the disruption, the hiatus which was always there, but never quite clear to the public eye. So the silver lining to the cloud is it's there for all to see. It's there for the very sort of very hard eye also to see what's really the case. Some of us as social justice proponents, some of us as proponents who believe in an equal world had been arguing for this long time. But I think this is for all to see. Second of all, the solutions therefore do not only lie in giving immediate succor. Some of the immediate solutions, no doubt, lie in the fact of giving wage compensation, like the previous speaker Wendy suggested, three-month wage guarantees, free ration, like Soumyadeep was suggesting. Those are obviously immediate relief and must be done, quickly done. Thailand, for example, transferred 5,000 bahts within 1 week of the crisis onto the bank accounts of all people. So for sure, those kind of income transfers are short-term relief and must happen. Access to food, there's hunger, there's double burdening of work, triple burdening of work in the world of women, and there's violence against women, there's early child marriage. So you see all the social disruptions come together in some ways. But the longer term questions also need to be addressed. So I want to make that point, and I want to make that point with reference to long outstanding calls of informal workers for decent wages. First of all, decent wages, dignified wages. So let's not lose sight of those things. Let's not lose sight of the fact that we need workers' rights. You know, one of the responses that I have seen by several state governments in India and elsewhere in the world is to use this crisis to water down further, to dilute further years of gains of labor struggles all over the world. So we've seen some Indian states, for example, trying to say that now there will be 12-hour work days, trying to suggest that labor laws and labor rights will be held in abeyance for some years or some months. So in some ways, almost using a crisis to steal away the years of struggle that labor formations have done in securing a better world of work, a relatively better world of work for workers. So that's the second point. The third point, and an important one world over, is with reference to the social security, or what is called the social protection itself. For all informal workers across the world, whose numbers are over 2 billion. India alone has 400 million that we are talking of. But if we go over the global south and the global north, this is about 2 billion people. So an outstanding demand for those 2 billion is dignified social protection, transformative social protection. And I think let's not lose sight of that, because another pandemic may come. And let's not treat it as one humanitarian emergency or one crisis to another crisis. What about the daily lives of workers? So I want to make that point at the outset before moving on to other points as and when the panel discussion opens up. And I think policy solutions, lastly to say, policy solutions therefore cannot lose sight of the long term. Here's an opportunity. Here's an opportunity for all the universities, for all the social activists, for all the social organizations of the world, for all the unions of the world, for all the workers of the world to use this time to make structural changes possible in the world of work and not to be defeated, because that's the struggle really. On the one hand, the other struggle, which I think the survey really talks very well of, is what's really unfolding on the streets of this country, is what's really unfolding on the highways of this country, is the tales of cruelty and horror that you see. And it's not somebody doing cruelty. It's the system that you can see, which is really cruel. And one needs to ask, am I a part of that system which is creating so much difficulties and so much disruption in the world of, in the lives of people who've made our nations, who've made our cities, and have absolutely no rights. So I want to stop here for the first intervention. Much.
Thank you, Sandeep. And now we are moving to Professor Ruth Steiner. Your general comments about this study, about the presentation, about the student presentations, please.
I want to compliment the authors on the comprehensiveness of the study. It's I'm looking at this and thinking this is an amazing amount of information on a population that is often overlooked in our policy discussions, which is really quite important. And, you know, you sort of listen to the, what do you need to do to deal with COVID? And it's, you know, stay home. It's take care of sanitation. It's wash your hands and stay away from people. And what it really draws in a number of issues. The challenge when you're looking at crowded places, number one, I think the other aspect is the way that the shutdown took place, which is shutting down intercity travel. And suddenly you're leaving people who really move around quite a lot in a specific place where they happen to be unfortunate enough to be located. And that's where, when I begin to look at this, what you begin to find is also this whole question of access, which is that when we shut down a nation, you're really talking about the ability to access things both of daily living, and those kinds of things come out in this study. For instance, when you begin to look at, I was struck by the linkages. What do you need? Medical assistance, groceries, subsidized housing, supplies, and vegetables. And the question is, how do you distribute them? You either bring them to people or people are brought to them. And when you tie that in with the lack of public transport, you begin to realize, and I would see that in many places in the world, we're beginning to understand the importance of public transport in an urban context as a way to allow people to go to access goods and services. So I'm looking here and thinking about what the lessons are from this, and there are so many lessons to be drawn that really relate to how we think about a disruption of essential services for a population, both in the short term, but really thinking about how do you reconstruct that after we come out of this, the lockdowns that have been taking place.
Okay, thank you, Ruth. Somehow I think Arjun was disconnected. So Arjun is our fourth panelist, and I think he'll come back. He just texted me that there is some reason internet is not good, but definitely he'll come back in a minute or two. So in the meantime, let's focus on some of the questions I have had on a specific question. See, there is no doubt, Sandeep, you're absolutely right about it. This is not the time again to talk about the horrors of or the problem we already have in the unorganized sector. Okay, unorganized sector, like it's a huge, I think 90% of the workers in unorganized sector, we know that social security is literally not there. They don't have health access to good health facilities. They don't have social security. They don't have job security. And these things, we are trying to somehow fix this from past 50 years, and we have failed, definitely. So I'm not going to go in there. I'm just going to accept that is the reality. Now the thing is, when you have this kind of reality and you are facing a pandemic like COVID-19, which has impacted about 5.7 million people in the world, how you're going to protect the 90% of the workers who are in unorganized sectors? In fact, the prolonged lockdown in India has also started impacting the middle class. This is now another worry, because if it is impacting middle class right now, you can just imagine what it has done to the people who are in organized sector without any job security. So the horror or how brutal it has been, I think we can comprehend that. But the bigger thing is what we are going to do about it. Because so far, at least from the news outlet reporting, and that's why this kind of study is very important, because this is giving us a picture of what's going on to some extent, and not a newspaper report. Because newspaper report is often based on 1 or 2 stories, and here we have at least 3,000 stories to talk about. So we have comprehended 3,000 stories here. Yes, Sandeep, please.
Yeah, no, thanks. Thanks for saying what for now. Yeah, and I think see, on an average, we are dealing with about 15,000 workers every day on an average for the last 2 months. Anyway, so those interactions tell you a range of things that need to be done, yeah, in the short term as well. So I'll base it from there. I'll not get into what only has to be corrected more structurally. But let me get into lesser of structural transformation kind of solutions. And those are as follows. You know, one of the things is what comprises a good worker stimulus. The question is, a welfare state must give stimulus, and we are all talking around it. So what comprises a good worker stimulus, or worker-oriented stimulus? I think that's the question to answer. So there's this category of a package of what's called the direct stimulus. We were talking around it. Now, what's the direct stimulus? The direct stimulus goes into creating what is called a work security. Now, work security, whether in the rural area, we have pre-existing possibilities of creating work security, which is through the Mahatma Gandhi National Employment Guarantee Act. Now, through this, the ask of civil society, the ask of unions is to ask for 200 days of work to every worker who wants the work, irrespective of where the worker is from. So I think there are concrete things. The package includes ensuring free ration supply, not just for the period of lockdown, for the months after the lockdown, by the time the worker is now able to potentially return back to the possible place of employment with or without that employment standing. And this study points to some of those implications. The point is about the possibility of creating small rural livelihoods. You know, many workers we've talked to, and I'm sure in this survey also a sample of workers tell that we are not sure if we want to really go back. Yeah. It's too early to say, and some may never go back. It's not just because their jobs were anyway insecure. So how do you create in the rural context collective rural, small rural, cooperative rural industrialization? There is an opportunity, and I think we must seize those what was being pointed by some other speakers as autonomous or sovereign solutions or local sovereign solutions. I think those need to be seized. So there's a package of support around the worker stimulus. What can be done with the family? What can be done to transform the world of work for women? Here's a big opportunity. Here's a big opportunity to ensure equal wages for women. I mean, that a welfare state can do. It doesn't need to go back 50 years. It can do by, there is a legislation already, one has to implement it. Ensure that more promotion, more financing, more support to women's enterprises, collective enterprises, of which there are again local solutions. So there's this side of the worker stimulus. Second is the side of the place where the workers work. Now that, I think, some initial steps the government of India has taken, and that needs a lot more, because we've seen analysis of that, we've done analysis of that, what is called the fiscal stimulus to the small, medium and micro enterprises, because an overwhelming majority of the informal workforce is in the very small SME sector, as we call it in India, micro enterprises, small enterprises or medium scale enterprises. Of course, there's a classification change going on. And the third is to ensure that no further dilution to labor laws is promoted at this time. Because, you know, it's another thing to gain further rights, but what is already there cannot be lost. So we cannot, you know, 12-hour workday may give the worker an opportunity to earn a little bit more. I'm not so sure as well. But you know what it gives rise to? It gives rise to tremendous health costs. That is why an 8-hour workday. So I mean, one has to see.
Absolutely.
So there's this. Yeah, go ahead, please.
This has been a big concern. You're absolutely right. I mean, government or industry, they want to change labor laws because they can at this point of time, and not necessarily. In fact, some 70, 80 years back, same kind of movement happened so that we have 8 hours of work day, because something like similar thing happened, not COVID-19, but another recession and the worker uprising.
Yeah, the Great Recession, no?
Right, and now we have what's happening is completely opposite of that. So it's an irony, but definitely I really hope this doesn't happen, or at least there should be a widespread consultation. Think about the cost, think about the benefits, not only
one last point I'd like to make is on the question of public health. And I think we've talked less at this moment about the lessons we all have for reviving a strong public health system. And I think the world is learning that lesson. So including our country, private health is private health. Public health is what gives tremendous human resources potential for future. And I think that's something that when people are going back, we are setting up these temporary quarantine mechanisms. Yeah. Now we don't have those spaces. And even when those spaces are there, the facilities are not there, which enables good quarantining, for instance. So let me just stop there. But there's a whole range of things that one can imagine basis of some of the ideas coming out of the study.
Absolutely. And, I have one very specific question to Ruth, and also other panelists can jump in any time. What we have seen is somehow the idea of public transportation and planning has taken a backstage. Whatever was the prevalent idea, that's not longer working. People now don't prefer, or they should not, because we are actively advising them not to travel via public transportation. And somehow we were championing this idea from last 50 years or so. So what to do about it? What is the future of public transportation, especially in the post-COVID-19 era? And of course, this is too early to talk about this. But then because you're here, and we just wanted to hear some of your thoughts. And anyone can jump in, please.
Yeah, could I comment on that? I think we might also take up one of the questions that was about political will. Have we seen the political will?
Yes.
So in other countries, the public transport is open. Here it was nationalized immediately, and they reduced all the schedules tremendously. And they said only the essential worker and key worker can go in public transport. And that means all the nurses and doctors, they all had access to buses and public transport. And same with trains, it was fully nationalized immediately. And that's an amazing step, because our government here in Britain, it's a neoliberal government, it's commercial, it's corporate establishment, but they did that. And I think that that's a really important aspect of that political will, that even when the government is betraying you long term, you have to make these demands, and they have to see the sense of it, But even then, the public transport long term, we need a lot more supply in India. Many people have absolutely no access to public transport at all, especially in rural areas, or if they can't afford it, or it's so full. A lot of women are completely discouraged by the system being so crowded. And so there is that question. I like it. He said, or she said, what about the true political will? What's the hidden agenda? And I think you've picked on the hidden agenda, Mr. Abhinav. You said that it was about the health, and I think health insurance. I think your government is wanting only to sell more health insurance, and you'll solve your health problems privately. And this is a travesty. And you have said rightly, public health generates huge social benefits and huge personal and life benefits and longer life. So I think at the moment, if I was working locally with other champions, knowledge champions, service champions, we saw it before in tsunami time, tremendous efforts across groups within each city, then we should work on the public health.
Perfect. And Ruth, please.
So your question is one that I've tried to wrap my head around, and it's extremely difficult. And I think Wendy has touched on one aspect of it. Whether we like it or not, in the US, what has really happened with the public transit systems that have continued to operate is that they have provided transport for essential workers who have no other choice about how they travel. Because quite frankly, if they had access to an automobile, they would probably be driving their own personal automobile. Now, where this discussion gets interesting in the US context, but I would assume in many other places across the world, is that public transport had been suffering even before COVID because of the availability of Uber and Lyft and other forms of what is called shared autonomous travel. And the dilemma is that those systems were subject to the same challenge as public transport, in that nobody knew that driving in a car with a random driver is seen by many as being no safer than driving in a collective vehicle. But I will, and within transport discussions, there has always been this distinction between choice riders, those who choose to use transport, and those who are transit. Captive riders is the term used. And arguably those captive riders have had to continue using it because they've had no other choice about how to get around. I will tell you what I have heard. I have a brother who lives in Manhattan, and he was talking about, you know, things going back to normal in Manhattan. And of course, those of you who know public transport in the US, over a third of all transport trips in any given year are in the New York metropolitan region. And that is becoming a real challenge to wrap. Even the policymakers there are struggling to wrap their head around how they will bring workers back into offices in Midtown Manhattan without public transport, because the ability to move will, if everybody who has a car is trying to get back into work with their automobiles, that city is going to close down from traffic congestion. So this questioning of social distancing on public transport is difficult. And that's sort of the crux of it. Now, some people suggest solutions of making fare-free public transport, which would provide a solution for the essential workers or people who are lower income. But even that solution assumes that you can safely social distance while you're traveling, and that the cleanliness is such that we're not going to have continued transmission of disease in that particular venue. And we haven't found a way yet to ensure that.
Okay, thank you very much, Ruth. So what I'm going to do is, we have enough question and we are already over the time. Our initial, we thought of 75 minutes, and we should be wrapping it up. So what I'm going to do is, I'm going to point some questions to either panelist or the presenter. So one of the question I have right now, and there are many comments, I'm going to talk about comments. Like one comment I really like, rather than saying social distancing, we should say physical distancing, because this is the time we should be socially together. And that may help the stigma attached to this disease. Anyway, Soumyadeep, I have a question for you from Professor Shipra Matra from IHD. And she is saying the issue related to the informal workers are generally subject to state. So the success of central government program depends to a large extent on the acceptability of this state. It is very important to involve local bodies in spreading awareness and distribution of material. Can you throw some light on it? So briefly, and this is very related to your research area, Soumyadeep, because absolutely here we are talking about the decentralization, and somehow it cannot, whatever center wants to achieve it, the vehicle has to be local bodies and the state. This is kind of norm. And given that state and center, often they are in loggerheads, it's not helping the people who need help. So can you throw some light on it, please?
Yeah, absolutely. Am I audible?
Yes, yes.
Yeah, so absolutely agree with Professor Lichter's point that, yeah, local government should be stepping, and we need to implement all these policies, whatever policies which have been taken. We need to actively involve the local government into the policy making. Okay, and unfortunately, the story of India is that, as many of our panelists mentioned, like especially Mr. Sandeep Mishra mentioned, like we should take this opportunity to think of empowering our local government. Okay, but unfortunately, even after 25 years of 74th Constitutional Amendment Act, which actually officially devolves the power and functions to the local bodies, nothing has happened yet. All we can say that the actual level of devolution at best can be described as partial. Okay, because if you can look at the functional aspect of the functional domain of the urban local bodies, there is a 12th schedule, okay, which specified 18 functions, and among them we are talking about all those public health issues. Okay, public health is one of the important functional domain of the urban local bodies. But if you see the state of functional domain to the urban local bodies, you will not see, you will hardly see that there are lots of commonalities are there between the urban local bodies and the parastatal agencies which are kept at the state level. For example, just take the example of water supply, which has huge implication for public health. Okay, but in all the major cities of India, there are a lot of coordination problem between the city government authority as well as the parastatal agencies which are there operating on the water supply. So these are some of the problems. And another major problem is that the urban local bodies, they do not have the requisite finance to perform their responsibilities. Whatever devolution has been taken place, though limited in nature, urban local bodies, they do not simply have any resources to perform their urban local bodies. And third problem is definitely the problem of local capacity. Okay, I have just looked at the recent report by a leading organization. So it actually says that the number of workers per 10,000 population is only, I think, 7 or 8 for a big corporation like Mumbai. And for a city corporation of Patna, this figure is 1. So this is the level of capacity which is there at the local level. So that is absolutely any sort of program. If implementation is key, whatever program is needed, implementation is extremely important. So we need to empower the local bodies to facilitate better implementation of all the policies which have been taken at the center or state level. There is a huge possibility, and we should take this opportunity to empower the local bodies to the fullest extent.
Okay, thank you, Soumyadeep, for a great response. We have many questions, but most of the questions we have somehow already taken up. For example, we have 2 questions from Purnia, Bihar, and Sanjay Kumar Das had a question, and he was asking about what to do about the casual laborers in unorganized sector. So at this point of time, of course, this is the biggest debate we have, but Sandeep talked about, like, at least whatever available we have, like Manrega, for example. How about 200 days employment guarantee? But definitely this is a situation we need to address. And this is something which is going on. This will be debated for a long time to come, because this is not something which can be solved in a snap. Also, then we had, there is one question from Debangana.
Informal sector.
Please.
I'm sorry to interrupt.
Yeah, go ahead.
Thank you. Just on the informal sector, so Purnia from Bihar has sort of implied that it is inferior to have informal sector dominating, but this is a sector of great flexibility. So some people are going home anyway in harvest time or in festival time and enjoying having that home in some separate area from the slum. So I think I'm more thinking that we should completely rework our thinking about this. Informal sector is a key part of how people are living. And the economy is how we live, how we allocate our time and then our resources to live together in peace. And then you have GDP. The economy is not just those jobs that contribute to the earnings by salary. So I'm not that convinced about something like the MNREGA replacing the real economy. MNREGA is very temporary, short term. There's a lot of bribery surrounding getting access to MNREGA. And then it goes and they say, no, there's no more work. So I think informal sector is the thing to celebrate and develop and just find out where are these bottlenecks. I'm making lists now, which are the bottlenecks for sewing. that when people are sitting in their homes week after week in the coming weeks, how can we provide a basket of, a parcel to enable sewing, which is that bottleneck for basket making, bottleneck for pottery, bottleneck for vegetable making in pots on roofs. So you've got to think creatively about the positive aspects of informal sector.
Absolutely. Thank you
Can
so much.
Can I make a comment? I think is it okay to make a comment on that?
Yeah, please, please.
Yeah, it's interesting. The point is, do we celebrate the informal sector as it stands today? And I'm just stretching the argument a bit for the sake of discussion and debate. And I respect the views Wendy has just given. And of course, needless to say, the informal sector seems to be a reality and the new reality. The point is what to do about it. And I think there are issues associated with the informal sector. Let's come to the word informal sector later, but what characterizes the informal sector is the cause of concern, which we must fight against, which is absolutely subhuman level of wages. In India, in the largest number of people, even the minimum wages are not being adhered to. And the minimum wages itself are at abysmally low levels for a decent life in the current context. And that's another struggle to enhance the level of minimum wages. I mean, whether the economy can sustain, there are many debates around it. But let me put it. So these are the crucial struggles. Informal sector in India stands for trampling of labor rights. Nowhere in the informal sector, because there's that demand-supply question. So what kind of protections, what kind of labor rights do you afford out to the workers? 400 million workers who struggle on in the informal sector is a struggle for the workers themselves. I think that's the other issue around informality that we need to be very cautious about and careful about, and make an advance in a progressive way. The third is with reference to social protection and security. So I think in all those dimensions, it's what informality stands for. And like Wendy said, well, that's the reality. So we need not only take informal sector, ILO comes and says that informal sector is the new reality. So let's accept it. But the point is, what do you accept about it? And I think that debate will continue. And I respect the kind of views. And sure, it's right. NREGA is not the only solution. So obviously, one of your esteemed participants was asking a question around agriculture. The problem is, and I'd like to answer it and stop at that. And the problem is, once you go back, so many circular migrants have now gone back, and many are in the process. Now, once you go back, are they going to be into farming? And if they are going to be into farming, will they drive the wages in what is called the informal sector within farming, the agricultural workers? Will they drive the wages even further lower down? And why in the first place was there a rural exodus? There's a whole agrarian crisis that we know of, right? So the reason why workers left the farms in the first place is because there was no space for them, because there were no land rights for them. So to answer the question of farming, the Bangna, the lady who asked, one must go back to the question of land rights and the challenges of who owns land and who doesn't own land in modern day India, and the failure of land reforms in the past 70 years. So I think there are those issues. So we can't just gloss over and create rural employment. There are a whole range of things that need to be done. I'll stop there.
Yes, and Arjun, what about the government support? There has to be a debate on the government support, the role of government, what government is doing, and we need to hear from someone. So Arjun, please, can you go ahead?
Yes, right. Thank you so much. I would like to thank Sandeep Mishra sir so much, because this study is part of a study which we did, and that has also been published now. And that study was, where will the CityMakers stay? And he has also dealt IMPRI, also his own kid, and also
Your voice is breaking.
Your voice is breaking. Okay. Okay.
Okay.
All right. So I'll just try to add upon few of the things, macro perspective, especially since our panels are from India, UK, and US, and the welfare system typically differs. So after the lockdown, one of the package which was announced is called Pradhan Mantri Garib Kalyan Yojana. Prime Minister and, no, is it bad?
Yeah, sometimes your voice is breaking. Is it me or it's breaking for everyone?
It's breaking for everyone.
Okay.
Yes, I can see that. Okay, so in Pradhan Mantri Garib Kalyan Yojana, we typically gave 500 rupees to the Jan Dhan account of
Arjun,
that package was almost around.
Arjun, we can't hear you at all. So I don't know what's going on. Can you connect via a different device if possible? And let's see if that changes things. I see you have a different device also. Can you connect via other device? There might be some sound issue. Okay. So we'll come back to this in a minute. And I am just going to either answer some questions or at least let the participants know that their question has already been answered, because I really am very impressed with the breadth of questions we are getting here, the kind of participation we have. That's very impressive. And I want to make sure that we take care of, we at least acknowledge all of them. Secondly, we need to realize we are almost 45 minutes out of above and beyond our time limit. Chair had to drop off. He had a 10:30 meeting, 10:30 US time meeting. So Chris, he just sent me a message saying that thanking each and every one of you for a wonderful discussion. So he had to go. I am going to be I'm going to be very, very quick here. And a couple of things. So for example, couple of debates or the things attendees have asked, I'm just going to go over that. For example, the urbanization debate. Are we really going through the de-urbanization phase, or this is going to be a great reversal? Because in 2007, I think all over the world, we were celebrating that for the first time in the history of mankind. More people live in cities than in the rural areas. But somehow, I don't know if if this pandemic is going to reverse that. If that is the case, there has to be a big debate, but it's too early to say. But this is something which we need to keep in mind. No doubts about that. Second, somebody is asking question about agriculture, which Sandeep already answered, and thank you very much. Debajati Das is talking about green revolution. Basically, he's saying how technology can be employed to solve the food crisis. We need alternative agriculture. I definitely agree. We need everything we can use at this point of time. Okay, this is an unprecedented crisis, so definitely we can use everything we can get our hands on. The second thing is the question about migration. I think we have been talking about migration throughout. So Bharat Singh was asking a question about the migration and how to tackle it. So fundamentally, this whole debate has been about migration, and thank you for this question. And then finally, how can the effective demand of unskilled labor increase in this pandemic situation? This question is from Saharsa, Bihar, Anil Kumar. We have a lot of questions coming from eastern states, Bihar, Calcutta, and one from South India also. So definitely, it's very hard to answer this question that, how we can increase the effective demand of unskilled labor. But again, Manrega is one of the solutions which we already have. Manrega has been see, the thing is, in 21st century, there is no doubt that we should not have a program like Manrega, definitely. But a country like India, somehow we see that Manrega is a lifesaver. And over the time, we have seen Manrega coming to the rescue. And right now, Manrega has a big role to play. So of course, if you think about where unskilled labor can go, Manrega is one of the solutions. Now, just a couple of more things I'm going to talk about, but let's ask Arjun to finish his thought. Arjun, please go ahead. You were talking about the government, and be very brief.
Yes, am I audible now?
Yeah, yes, you are.
Yes, so let me summarize what at the policy and at the government level things which has been done. So the first scheme was announced was around for $22 billion, and that was called Pradhan Mantri Garib Kalyan Yojana. And recently we have announced a new scheme, a whole package called Atmanirbhar Bharat Abhiyan, Self-Reliant India Scheme, wherein 10% of our GDP is earmarked. Most of them are monetary measures, not fiscal. So that's amount to around $300 billion. If we simply divide it by the our population, then the amount would come to meager $200 per person. And the kind of assistance which we have been able to give so far has not been even $10 to $20 per head. So overall, the $300 billion which has been Atmanirbhar Bharat Abhiyan, and dividing it by the whole population, $200. In US, the unemployment allowance per week is around $300 to $400. That's a gross mismatch. And the kind of PDS and other things which we are providing, just the grains, it's really not enough. And in the whole of our survey across India, there has been demand for good food, good supplies. That is one. So the kind of direct cash transfer, as Professor Wendy Olsen is suggesting, that has to be done. And it's non-negotiable, and at least ensuring it for at least next 3 months, because Narega we are discussing, but that's a rural economy. But in the case of CityMakers, and especially in terms of extended lockdowns, some sort of cash transfer. That is why we are saying that cash transfer in tune of $1 a day. That would $30 per month. That would translate up to 200 rupees here. In India per person for having and this estimate is based on the Thalinomics, which Economic Survey is talking about, and it has been based on National Institute of Nutrition, Hyderabad, and they are giving this figure that for a good meal you have to have rupees 25, a good thali. Yes, so in terms of government schemes and its reach, most of the literature and everyone has been highlighting that it is too little and too late. It is not reaching, and as Sandeep sir is highlighting that it has to reach now. And given the circumstances, we have to have measures which are quick, responsive, and above all caring. Yes, Abhinav.
Okay. Thank you, Arjun. And Wendy also had to go. And this is a cue that we need to stop now because this has gone on for too long. Just one last comment is, we have been talking about deurbanization. We have been talking about other things, how the hardship people have been experiencing. I remember, in 2010 or 2010 onwards, the thing was, we were talking about the inspirations of the poor. There were a lot of talk, a lot of articles. People were talking about how poor people in India have aspirations and how much they want to, why cities are important, why they are going to cities for the better future. One needs to remember, people who are going back, we are going to see a huge blow to the intergenerational mobility. It takes a couple of generations for people to become better than the last generation. And somehow people going back to cities is going to rob them of the bright future they had planned for their kids or the next generation. Anyways, and I would like to thank everyone. And of course, we can't take all the questions, but I'm going to promise one thing. What we are going to do is we are going to assemble all the questions. We are going to answer all the questions, and we are going to post it on the website so that everyone has access to one, the PPT, and the second, all the questions, and they're answered by the experts. And right now, I would like to thank you, every one of you, especially the participants, because it's like, again, 2 hours. We promised, the time slot was for 75 minutes, so it's already 45 minutes more than the time slot. But anyway, thank you very much for staying, for engaging. It was amazing. And thank you, our panelists. Chair had to go. Right now we have Ruth is here, Arjun is here, and Sandeep. The presenter Soumyadeep, thank you very, very much
And
for this.
Abhinav, you can put on the picture slide, yeah.
I'm doing that. And then I would also
Yes.
like to thank the coordination team at the IMPRI, and plus students. I'm going to show you the pages. This is the, of course, you have seen this cover page. This is the coordination team at the IMPRI, and these are the student researchers who have been involved in this research. Without them, simply it was not possible. They were wonderful, and especially you have heard from the video diaries and everything. I'm very proud of them. It was a great work. So thank you very much, guys, and keep it up. Okay, so I'm going to end this session now. Thank you very much, everyone.
Thank you, everyone. Have a nice day.
Have a nice day.
Yes.
Okay. Stop cloud.